It's time now for the bonus for your health for Medica Pharmacy and Wellness. This is the 5th Thursday, which means we'll have another show next Thursday too, but welcome in, Alyson.
Yeah, thanks for having me. It's finally sunny and warm.
Yes.
It looks like the next few days of summer is arriving early and with a bang. You know, we went from chilly on Tuesday and a little bit yesterday to it's muggy out there today, and it's supposed to be nice and real toasty next week.
Well, and maybe a little rain in between now and then, but anyway, it's that time of year in Kentucky. I made the mistake yesterday. I was talking to somebody, and they somehow they had allergies, and I said, "Well, it's Kentucky," and he said, "No, I've been in Ohio all week." I said, "Well, I guess they're bad in Ohio."
Yeah, the Ohio Valley, man, it's no joke with people with allergies. Yeah, well, you know, I actually yesterday I was like, I'm tired of the rain, and I don't often say that this time of year because once you get to this time of year and you start fussing about rain, you might not see rain again until like September, October. So I try not to fuss, but it was like I'm ready for like just a week of warm weather and sunshine, and of course I'm headed to a country where it's still winter, but it's supposed to be 75 during the day, so that'll be okay.
Gonna be nice.
Yeah, that's right.
All right, today's subject, did I hear you right? Cash?
Yeah, everybody likes cash, yeah. Well, cash in the sense of, you know, part of what brought me to do this is if you pay attention to the government at all, which you kind of have to, and sometimes you just want to, sometimes it's like a dumpster fire, but there is some talk around trying to lower the price of prescription drugs. Now, those of us that work in healthcare will say how they're trying to do it is not really ideal, and it doesn't solve the problem. So the problem is that the people that dictate the prices are the PBMs in the middle that we have fussed about for years, and so trying to just lower the prices doesn't mean that the PBMs are going to be any less corrupt or find more ways to snaggle money from you, your doctor, your pharmacist, your nurse, whoever. So, but things are expensive, and even with people with insurance, a lot of people have really high deductibles. I'm one of those high deductible insurees. So I know what it's like to have a deductible that the only 2 times in my life that I've met my deductible is when I gave birth to 2 babies. Most of us never, if we're lucky and we're healthy, hopefully we don't meet those crazy high deductibles. They're more of a catastrophic plan. So that said, some people have high deductibles that when they go to get a prescription filled, they're paying a decent amount, and that may not, some of these drugs, so your basic, most of your cholesterol medicines, most of your blood pressure medicines, the vast majority of the antidepressants that we see, there are some that are not generic and are still expensive, like Rexulti. That is not a cheap medicine. But, you know, Lexapro, Celexa, Prozac, all your cholesterol medicines, all your statin drugs, a lot of your ACE inhibitors, so lisinopril, Ramipril, those drugs, all your pravastatins, atorvastatins, those drugs are cheap. And so some people have an insurance that with that deductible, so you may come in and you get a 30-day supply and it's $10 or $15. So this is where I want to talk about with cash. You may not have insurance at all because there are plenty of uninsured people out there, and it shouldn't be that you have to choose between your medicine and your groceries and your rent, but I know that that's the world we live in. And so I don't think people often think, how can yes, I don't have insurance, or yes, I have a high deductible. Would it be cheaper if I didn't use my insurance? And so part of the cost of filling a prescription is called a dispensing fee. And this is where the insurance companies have really destroyed a lot of pharmacies, is it doesn't matter what prescription you get from your pharmacy, it costs about $12 to $14 for them to fill it. And you might think, well, what do you mean? Well, we have to pay our staff, we have to pay our electric bills, we have to pay the software companies that we use for our pharmacy software, pay your pharmacist, all the you know, if you think about it, in your house you have normal bills, and that's what your fixed kind of costs are. But you have to put the medicine in a vial, you have to print a label, you have to ring it through the cash register. So that just to break even in a pharmacy, you're talking about $12.70 to break even. And so we go with $14 and gives you a little bit of extra money to pay, have a little bit of a profit. And profit shouldn't be a bad word, because if we have no pharmacies, then I'm not sure where everybody's going to get their medicine except for mail order. And as we walk into the heat of summer, your medicine getting really stinking hot in the back of a UPS truck and in your mailbox is maybe not ideal. And so can you save money by paying that dispensing fee one time, once or twice a year? And so if you're paying $10 for a 30-day supply of medicine, can you get a 6-month supply without using your insurance and save a ton of money? Probably. And so there are this what we call extended day supplies. Anything in any of my pharmacies is based on what we paid for the drug. And so if you don't have insurance, then we basically add $14 to $16-ish around there, depending on the cost of the drug. So if that drug costs me $2,000, it doesn't make sense for me to break even, because I don't want to pay $2,000 to bill your insurance, right, and then make your insurance takes about 3 to 4 weeks to pay us. So that's part of that problem with those GLP drugs, and why so many pharmacies don't want to sell them, is because your insurance doesn't pay anything on it until about 3 or 4 weeks. So we're paying $2,000 to get paid for that drug and maybe make $10 on it, $15 tops mostly. And the problem is a lot of those have a little manufacturer coupon snuck into the claim, and the coupons actually don't pay you for about 4 months. And so that's why so many people don't want to bill them, is it's hard to front thousands of dollars and then not get paid for those thousands of dollars of drugs for 4 months. So if you have cheap generics, then I'm happy to give you 6 months if you have a 6-month prescription, and you might pay $35 or $40 for an entire 6 months. You might pay $70 for an entire year. And so that's kind of the range of prices. Some of them are cheaper, some of them a little bit more. We do try to round it up and make it easy for you, but even if you just want a 30-day supply, I'm still going to have cost plus. And if you're familiar with Mark Cuban, he's all over social media talking about his cost plus pharmacy. Most independent pharmacies have a cost plus model, and so we can do the same thing at the Medica pharmacies that Mark Cuban does. He does have access to a few drugs that we don't, so I can't do. There are some specialty drugs that he's been able to work with manufacturers to get that we maybe can't do, but we can look into that. So always inquire. Things are expensive. They're not getting any cheaper yet. And so if you want to save some money on your prescriptions and you're on a maintenance medicine that you've been on forever, then come talk to us about getting you that 6 month to 1 year. You're paying that dispensing fee one time, saving you some money and ultimately some time. Because, we do the sync program to where we get all your medicines to come out at the same time, and some people are 30 days and some are 90. Well, if you've got, say, 3 maintenance medicines and you want to get them all 3 filled, then we can just enroll you in a sync program and give you 6 months worth or a year's worth, depending on how many refills worth your doctor would give you. But ultimately trying to save people that either don't have insurance or underinsured, which there's a lot of those out there, or again, high deductible plans. Find a way to get you these medicines that you need for a cheaper price. And so that way you don't have to come to the pharmacy every month if you don't want to. A lot of insurances we are limited to 30-day supplies because they don't pay otherwise. Some of them they don't contract with us for anything more than 30-day supplies. No one says you have to use your insurance, so if your insurance copay for 30 is more than you can pay for 6 months supply, you don't have to use your insurance. So it's your call. But it's just, trying to save some people money, some time, and get you a little bit better bang for your buck when it comes to, dealing with the cost of prescription drugs.
It's worth asking.
It is worth asking. Always ask, is this better on my insurance, or would I be better to get a longer day supply without my insurance? And we can give you that information. And, most of the drugs we know we can call, but if you're, I can always look that up with a quick click of the button of the computer, and we can try to save some people some money.
There are a few drugs that, what would you say, spoiled? They're time sensitive or refrigerated, and you got to...
Well, even the ones that stay in the refrigerator. So, for example, most insulins are good out of the refrigerator for 28 days. But even if they're a refrigerated drug, as long as if you wanted, there's not a lot of cheap stuff that goes in the fridge. I always joke your expensive drugs go in the fridge. Now, that said, there are some glaucoma eye drops that are fairly inexpensive. They're also good out of the fridge once you get them home, but if you got a 6-month supply of them, you keep in the fridge what you're not currently using until you get to it. And then the expiration date is still good. So it shouldn't be bad. There's a few things like probiotics over the counter. There's a couple of probiotics that are really potent, and they're not necessarily required to be in the fridge unless you're taking them only a couple times a week, and then that bottle is going to be open and closed long enough that I would recommend that you put things in the fridge to enhance the longevity and protect the potency of stuff like a probiotic. But most prescription drugs, you're fine.
Okay.
Yeah.
What else we got on our paper?
So, we talk about digestion a lot, and so I always talk about probiotics and digestive enzymes, but there are some of you guys out there that have pretty bad heartburn. And so sometimes just a basic probiotic and a digestive enzyme is not going to get you where we're going. So I just wanted to talk briefly about a couple of products that I'm really having to lean on here lately. Is, we've been talking about getting people off these acid lowering medicines because of all of the chronic problems they cause, and some people are making me work pretty hard to get them feeling good. So I thought, let me just mention a couple of supplements that, some people say, oh, I heard you talk about digestive enzymes. Some people will get them because they heard about them, but there's two products, actually three. If you have really bad heartburn, you're probably zinc deficient. And, especially you get a lot of people with heartburn have that, they're either constipated or they have chronic loose stools. So that inflamed digestive tract depletes you of zinc. So zinc carnosine is actually a specialty product. It actually is used in Europe and Asia to treat H. pylori. And if everybody knows what H. pylori is, it's that little bacteria that causes stomach ulcers. And so it's used in other countries as a prescription product to treat H. pylori, but it is phenomenal to not only stop heartburn, but it actually heals your stomach. So when you're really bad heartburn and inflamed, that zinc carnosine kind of shuts down that inflammatory process in the gut. It does help restore your zinc levels. Some people can see a difference within 3 days. It is something that's designed to take twice a day. You don't ever want to take zinc on an empty stomach of any kind. Zinc can make you very nauseous if you don't have food on the belly. So zinc carnosine would be twice a day. It doesn't guarantee that it's going to prevent like esophageal cancer, but it can heal the tissue. That and a product called Rhizinate together, phenomenal. So zinc carnosine, if you're really, really bad, twice a day for at least 30 days. Some people will need it for 2 months, but most people 1 month worth will kind of fix it. We also have a product called Heartburn Advantage, and I think people balk at it a little bit because it is not the cheapest thing in the world. It's not horrible, but it's one of my more expensive digestive support supplements. But that's because it actually combines two products into one. There's a product called Motility Activator for people that have really kind of chronic constipation. And, some of you people are taking, Linsets and Trulance and all these really expensive prescription medicines just trying to not be constipated. This is where Heartburn Advantage can come in, because constipation is the number one cause of heartburn. If your food doesn't go out timely, it has nowhere to go but up. So you get heartburn and bloating and belching and all those things. So Heartburn Advantage combines that motility activator to help that lower stomach empty, and it actually helps to kind of pump things through the top duodenum, which is the top of your intestinal tract. So you don't always need that motility activator alone. So a little bit of it in the Heartburn Advantage can help to heal your stomach, stop the heartburn, and empty your stomach in a more timely fashion and get things going through the gut in a more timely fashion. So, we always talk about vitamin C and magnesium will help get your constipation kind of corrected, but that Heartburn Advantage, sometimes you just need a little something extra in the beginning. It's pretty profound, and it's comical to me. I don't think a lot of people realize that every now and then you'll be out talking to somebody and you notice that they have a very strange odor on their breath. Bad odors from your breath is 95% of the time a digestive problem. And so if you can correct that inflammatory process in the gut, you'll do wonders for the breath issue that you have. And that is where things like Heartburn Advantage comes in, because it does kind of clean up that gut, get things going in there, and then it will help you have better breath as well. Just a fun fact.
Are these over the counter or prescription?
All over the counter. Yeah, though zinc carnosine is prescription in other countries, it is over the counter here. And it's funny, I tell people, if you are fairly nauseous on a regular basis, or if you have a fairly strong gag reflex, like I have had people say, I really struggle with multivitamins because when I open up the bottle, it makes me gag. That is a for sure sign that you are probably zinc deficient, and people don't always think about that. Sometimes it's just, I tend to get gagged. Sometimes when I'm swallowing, I get a little nauseous, or I want to gag things up. Sometimes it's as severe as you open up a bottle of something and you get a little bit of that gag reflex. That is a sign of zinc deficiency. And so it may not be, but it is definitely a sign. And we have had people that have come in with that, put them on zinc carnosine, and within 3 days that gag reflex is better. So yeah, it's a phenomenal product. So severe heartburn, strong gag reflex, inability to tolerate the smell of vitamins, all signs that you might have an inflamed gut that needs to be addressed.
Okay.
Yep, so that's it. So cash prescriptions, kind of an easy show today. And then just a few more tools in the digestive toolkit to try to get people able to go and enjoy and not be bloaty and belchy and upset stomach and live a healthier life.
Do we have another visit from our representative from Innovative?
I'm glad you said that. I almost forgot. She is coming this coming Tuesday. So June 3rd, Kathy is coming back 11 to 3 again. So if you have not taken advantage of her, do come in. There are times where you might get way more information you ever dreamed. So she might talk to you for 30 minutes. She might talk to you for 5, but she might talk to you for 30 minutes. I know a friend of mine was in, and she talked to her for quite a while, and I believe followed up with some emails to her as well. So she's just amazing. And if you can't come in Tuesday, shoot me a message via Facebook. If you're a Facebook friend of mine, if you're not a Facebook friend of mine, go to the Medica Pharmacy page, send a message there. So if you have a specific question, because we do have a public event, and so you could also join that event and post a question there. So we're going to try to find a way to answer people's questions that aren't able to make it in as well.
Okay.
So, and I can answer some of those questions as well, but if I don't know the answer, then I'll forward it on to her and we'll get you taken care of. But she's amazing. So if you can come in Tuesday, June 3rd, 11 to 3, we'll be there to answer any questions you might possibly have about a lot of people want magnesium glycinate. You don't have to have magnesium glycinate. She explains that better than I do, but there's a bunch of different magnesiums on the market, so she can better explain to you which magnesium does which. Like, we do have one that's really specific for the brain, so it helps with migraines and sleep better than the one that helps with constipation. So there's a lot of different varieties. Berberine that we talk about all the time is phenomenal, but there's a different type of berberine that's a natural antibiotic, and so there's just a lot to learn from her, and I'm happy to help. But she's been doing this twice as long as I have, so she obviously has a lot more tools in her toolkit than I do, and she's just wonderful to talk to.
All right.
Yep.
Tuesday, 11 to 3, June 3, Bardstown location.
Bardstown location. That is correct.
Okay.
Yep.
And then, of course, we're getting ready. I guess school's out. And we're getting...
Almost. Bardstown's out after, what is today? Thursday. Tomorrow is Bardstown's last day, and graduation is Saturday.
Okay. So we'll call that summertime.
That's right.
Give us some quick hints and tips for summer. We got sunshine today, which is good for you, but it can burn you.
It can, and I was actually just having this discussion with a gentleman today that it was recently diagnosed with melanoma. And of course, once you get melanoma, they tell you don't ever go in the sun. And I'm like, and it hurts my heart, because the sun and the vitamin D you get from UV sun is essential to your health. But yes, people do overdo it. So we all need that vitamin D from the sun. Hopefully everybody's kids can get outside and soak up some vitamin D this summer, but do be careful. 20-30 minutes out is what you need. Sunscreens, be careful. A lot of them are not good for you. I'm a big fan. The only thing we use in my household is mineral based, and it works fabulously. Yes, it turns you a weird color. Like, it's funny when you put it on, you look in the sun, you look a bit purplish, because it's some of them are white. Now some of them will rub in really well. There's one called Attitude that comes in a stick that smells like orange clementine or something. I don't know, but anyway, I like that one. It's great to travel with because it's a solid, so you don't have to worry about it being a liquid or a gel. And when you're traveling with carry-on luggage, all good. There's a bunch of them out there that are good quality, but you can always check them on the EWG website for toxicity levels. A lot, and it's funny, I have my oldest daughter and my niece both break out horrifically from the average sunscreen because of the avobenzones and all of the chemicals that are in them. So they do cause hormone disruption. They do cause skin sensitivity and rashes. So I lean towards the mineral bases, but I also am a fan of, once you've soaked up your vitamin D for the day, put on a hat, get under an umbrella, enjoy the sun and the warm weather in the outdoors without being directly in the sun. So you don't have to wear a sunscreen, but if you do, you need to cover up some way, shape, or fashion.
And then those swim shirts are very popular now. Long sleeve. You see them in the pool, grandkids.
Yes, those are my favorite when we are traveling somewhere to where we're going to be in like a resort in a pool or on the beach all day. So then you're able to soak up that vitamin D for however long you feel is good for you, and you're not going to burn. And then you throw that shirt on, and you don't have to worry about the constant reapplications of sunscreen. Or or the other one is, oh my gosh, look, I forgot, I missed this little. You have this nice little red stripe. We always get a giggle when we travel, when you're at the pool and you see somebody and you're like, I don't know who put sunscreen on that person, but they did a terrible job. So you don't have to worry about those crazy tan lines with a sun shirt.
which sometimes become designs.
You see people's like finger handprints down the back, which is always my favorite. So yeah, we like to. We always get a good giggle. Of course, the person that it happened to always gets a good giggle out of it too. It's like, yeah, my wife was terrible about putting sunscreen on me. Well, sun shirts do wonders. So.
This is in the health world. I've seen stories. I know of people. Tick bites are
ticks are awful this year. My normal dog tick treatments aren't working worth a darn. I have never seen it like this. It is, like I said, there must be something with the cicadas because allergies are off the charts this year. The ticks are off the charts this year. It is insane. And I really thought as cold, snowy of a winter as we had, the ticks wouldn't be this bad. They're terrible. My horses are covered. My dogs are covered. My dogs have the Seresto collars. I'm like, I guess I'll go back to the old school front line that you put between the shoulder blades. But it's a battle. We are actually pushing. So as you know, we have some protocols in pharmacy that allow us to prescribe things. So travel medicine. So I'm headed out of the country. If you have a travel medicine protocol, you can actually prescribe, the anti-malarial treatments or traveler's diarrhea stuff to patients without them actually having to go see a doctor. We do, flu and strep testing at the pharmacy. Springfield is authorized to do urinary tract and testing for infections. We're actually pushing to get a Lyme's disease prevention protocol so that if somebody were to get a tick bite, you can get that immediate antibiotic in you because, man, you don't want to mess with Lyme's disease. It is an autoimmune thing. It is chronic. It is long-term, and it can really be devastating. So, please be doing your tick checks. I'm also a fan, if you pull a tick off, throw some Neosporin on it, bacitracin if you have it, put some kind of antibiotic ointment right on that tick bite. There's a difference, obviously, between the little bitty ones and the bigger ones, but then you have that whole, oh my gosh, I'm drawing a blank, where you can't eat red meat.
Yeah, I know two people with it.
I know plenty of people with it, and I'm sitting there going, I can't come up with the name of it because I'm thinking about it, but yeah, so there's a whole thing. So you find that tick, man, get them off, put some antibiotic cream on it. You might call your doctor, but there is a push in pharmacy world for pharmacists to be able to prescribe you tick prevention things. So hopefully that'll be coming soon, but we'll keep you posted if it does.
Well, I just know, like I say, somebody that well acquainted with has it, and my mother-in-law had it. So.
Yeah, one of my girls that works for me has it, and
the good news is I think it does go away.
You can, and there is some digestive enzymes that can assist with that as well, but it's. Yeah, some people it's chronic, but I have a pharmacist friend of mine that fought it for years, and he's finally able to eat bacon again. One of the girls that works for me will go eat red meat, and then she goes, I'm just going to pay for it later. It is what it is. So, oh well, but yeah, I would be sad if I couldn't eat my steak. I would be a sad person.
All right, and as on this date, as a Rotarian, the Wine and Cheese event is this weekend. So.
It is, and I'm not in Rotary. I ran out of time, so I had to step away from the Rotary Club. But Wine and Cheese is Saturday, and of course I have graduation Saturday morning, so I'm not sure if I'll make it this year. I do have my son is graduating, so we'll see if we make it to Wine and Cheese. But the weather looks beautiful for Wine and Cheese, so it's a great event and it supports a great cause. So if you you don't have to like wine, they have a beer tent, and I hear they have some non-alcoholic wines this year. Yep. So yeah, beautiful setting, good event, good charities.
All right. That is the show for today for your health presentation of Medica Pharmacy and Wellness. We'll be back with another show next Thursday, the first Thursday of the month, here on WBRT Radio.